What is whooping cough pertussis? Whooping cough, also known as pertussis, is a very contagious infection that affects the lungs and airways. It causes a severe cough that can make a whooping sound when people take a breath after coughing. Before there was a vaccine, whooping cough was mostly seen in children. Now, it mostly affects babies who are too young to get all their shots and teenagers and adults whose protection from the vaccine has worn off. Deaths from whooping cough are rare, but they happen most often in babies. That's why it's very important for pregnant women and anyone who will be close to a baby to get vaccinated against whooping cough. What are the symptoms of whooping cough? When you get whooping cough, it usually takes about a week to 10 days for symptoms to show up, but sometimes it can take longer. At first, it feels like a common cold with a runny or stuffy nose, red eyes, fever, and cough. After a week or two, things get worse. Thick mucus fills your airways, causing bad coughing fits. These fits can make you throw up, turn your face red or blue, make you very tired, and end with a high-pitched whoop sound when you breathe in. But not everyone makes that sound. Some teens and adults only have a stubborn cough. Babies may not cough at all. Instead, they might have trouble breathing or stop breathing briefly. What are the causes of whooping cough? Whooping cough is caused by bacteria called Cough Pertussis. When someone with whooping cough coughs or sneezes, tiny droplets with the germs go into the air. If you breathe in these droplets, you can get infected too. Who is at risk for whooping cough? The vaccine for whooping cough you get as a child wears off over time. This means most teenagers and adults can get the infection during an outbreak, which still happen regularly. Babies under 12 months old who haven't been vaccinated or haven't received all their vaccines are at the highest risk for serious problems and even death from whooping cough. What are the complications of whooping cough? Teenagers and adults usually recover from whooping cough without any problems. If there are complications, they are usually due to the severe coughing and can include bruised or cracked ribs, abdominal hernias, and broken blood vessels in the skin or eyes. For babies under 6 months old, whooping cough complications can be very serious. They may include pneumonia, breathing problems, dehydration or weight loss from trouble feeding, seizures, and brain damage. Because of these risks, babies and young children often need hospital care. Complications can even be life-threatening for babies younger than 6 months old. How can you prevent whooping cough? The best way to prevent whooping cough is by getting the pertussis vaccine, which is often given together with vaccines for diphtheria and tetanus. Doctors recommend starting this vaccine series in infancy, with children typically receiving 5 shots at the ages of 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. The side effects of the vaccine are usually mild and can include fever, crankiness, headache, tiredness, or soreness at the injection site. To maintain protection against whooping cough, booster shots are recommended, especially for adolescents around age 11. Some adult tetanus and diphtheria vaccines also guard against whooping cough, reducing the risk of spreading it to infants. Pregnant women should receive the pertussis vaccine between 27 and 36 weeks of pregnancy to safeguard their baby's early months. If you've been exposed to whooping cough, antibiotics may be advised for healthcare providers, pregnant women, infants under 12 months, individuals with weakened immune systems or asthma, and those living with or in close contact with someone at high risk for severe illness from the disease. How does whooping cough affect the body? Whooping cough, caused by the bacteria Cough Pertussis, primarily affects the respiratory system. The infection starts with symptoms similar to a common cold, such as a runny nose, nasal congestion, red and watery eyes, fever, and a mild cough. As the disease progresses, thick mucus accumulates in the airways, leading to severe and uncontrollable coughing fits. These coughing spells can be so intense that they cause vomiting, exhaustion, and even lead to a red or blue face due to lack of oxygen. The signature whoop sound occurs when the person breathes in sharply after a coughing fit. However, not everyone makes this sound. Some may just have a persistent hacking cough. In infants, whooping cough can be particularly dangerous. They may not cough at all but can struggle to breathe or may temporarily stop breathing. Serious complications in infants can include pneumonia, dehydration, weight loss, seizures, and brain damage. These severe symptoms often require hospitalization and can be life-threatening, especially for babies under 6 months old. How does whooping cough spread? Whooping cough spreads very easily from person to person through the air. When someone with whooping cough sneezes or coughs, they release tiny droplets that contain the bacteria. Other people can then breathe in these bacteria and get infected. This is more likely to happen when people spend a lot of time together or share the same breathing space. How is whooping cough treated and what home remedies can help? If you catch whooping cough early, antibiotics can be prescribed to help reduce coughing and other symptoms, as well as prevent the infection from spreading to others. However, for many people, by the time they're diagnosed, antibiotics may not be as effective. Over-the-counter cough medicines, cough suppressants, and expectorants don't work for whooping cough, so it's best to avoid using them. Severe coughing can make it difficult to drink enough fluids, potentially leading to dehydration. If dehydration occurs, it's important to contact your doctor immediately for medical advice and treatment. To aid in recovery and alleviate symptoms, there are several home remedies you can try. Resting is crucial when dealing with whooping cough, as it allows your body to focus its energy on fighting off the illness. Eating small and frequent meals can be helpful in preventing vomiting triggered by severe coughing fits, providing necessary nourishment while minimizing discomfort. Maintaining clean air by avoiding exposure to dust, smoke, and other irritants can help soothe coughing and facilitate easier breathing. Staying hydrated by drinking plenty of fluids, such as water or juice, is essential to prevent dehydration, a common concern with whooping cough. If any signs of dehydration, like dry lips or decreased urination, are observed, it's vital to promptly seek medical advice from your doctor for proper guidance and treatment.